So my name is Dr. Grisham Smotra. I'm a consultant gynaecologist and I have special interest in early pregnancy care. Early pregnancy scans are usually performed from 6 weeks onwards up till 12 weeks. Usually it's advised in women who've had previous recurrent miscarriages, previous ectopic pregnancies, or if they're feeling anxious and they want some answers before their 12-week dating scan. It is also advised if you've been having bleeding in the current pregnancy. So when you come here for the consultation and the scan, what we do is I will take a history from you and to check your previous medical history, previous gynecological history, when the pregnancy started, and then we go on to have an ultrasound scan, and that basically is to tell whether the pregnancy is in the right place. That is the most important thing, to rule out ectopic pregnancy. Pregnancy is viable if it's in the uterus, and how many weeks gone we are, and whether we've got twin pregnancies or multiple pregnancies. So early pregnancy scan is quite useful, and it's easy to do, and it's safe for early pregnant women as well. So when we do the scan, after that we can go through the scan results with you, we can go through the images with you. Depending on what we find, we can then plan your further management. Some women who've got sticky blood syndrome, they might need blood thinning injections from the very start of the early pregnancy. Some women who've had previous recurrent miscarriages would benefit from progesterone pessaries. So these are the things that we can then plan early and start early. Endometriosis is a condition where the tissue that is supposed to be in the lining of the womb, that goes into the rest of the pelvis. It sticks onto the ovaries, on the tubes and other pelvic surfaces, and could be sometimes on the bladder and the bowel as well. In the UK, the average time from somebody having the start of the symptoms to getting the diagnosis is about 8 years. Which is quite long. And what we can do is, if you feel that you have symptoms of heavy painful periods, periods bleeding in between the cycles, pain between the cycles, painful intercourse, then you must seek help, see a gynecologist who can then, especially the ones who are trained to do the gynecology scans at the same time and who are trained to do endometriosis scan. And what we do at that time is we do the ultrasound scan, and it's not just to look at the uterus and the ovaries, it is to see what their relationship is to each other and to pick up those soft markers to see whether you have endometriosis or not. Things like when the womb is tilted backwards in a certain way could be a sign of endometriosis. There could be endometrioma cysts on the ovaries, which are different from the other simple fluid-filled cysts, which can tell us that you have endometriosis. And again, what relationship the bowel has with the uterus, whether it appears to be stuck to it. So those are the soft markers which can be picked up by somebody who is competent and has interest in endometriosis scans. So ovarian cysts are very common, and a common reason for women to see me as well. If they're common, most of the times they are benign and they do get resolved by themselves. But if you're having pelvic pain, one-sided pelvic pain, which is sharp shooting and it's persistent, then it is important that you seek help, get an ultrasound scan to make sure we've ruled out ovarian cysts. If you want to see us, either the GP with special interest in women's health or myself, just pick up the phone and give us a call, and you can go on the website as well.